The following is a paid promotional announcement for Dunes LASIK Center in Dakota Dunes. Dunes LASIK Center provides safe, painless, and affordable vision correction.
It has been ultimate freedom.
I could see clearly.
It was amazing.
Most people recognize we're sort of a unique practice in the country, combining an advanced clinic, LASIK center, and a high-level optical all in one location. There are several reasons to consider LASIK. It provides a more precise correction. It's going to give a better outcome, minimizing nighttime and low-light image quality problems. It's really just an advanced form of vision correction, trying to get that optimized image quality with better contrast, sensitivities, and better outcomes. If a patient is a contact lens wearer, for example, contact lenses are medical devices. They carry risk. They can be worn safely with proper supervision. We have hundreds and hundreds of patients in our office that wear contact lenses, but they will induce changes to the health of the surface.
I've been thinking about having LASIK surgery for quite a while now, and I was wearing my contacts for too long, and that has risks associated with it.
LASIK eliminates risk and is very safe. It's arguably the safest surgery performed in the United States if you look at the statistics, so much safer than wearing a contact lens to the overall health and vision risk to the eyes. We lessen the risk of them having an eye health problem in the future from a contact lens induced keratitis, which is an infection of the cornea. It provides better vision to them in almost all cases.
What I dislike most about glasses and contacts is how inconvenient they are.
I was the one that had a pair of glasses in my car, on my nightstand, in my purse, but when I really truly needed them, I never had them. I missed out on a lot of my kids' activities because I couldn't see clearly.
Contacts, the time it takes to put them in, take them out, they float, cause your eyes to irritate. You reach for your glasses every morning, every night. Where are my glasses? Can't see.
Every time I travel, I've got to remember to pack an extra pair of contacts, my contacts case and solution, as well as my glasses. Just thinking about not having to deal with my contacts or glasses anymore is really refreshing.
After LASIK, I don't have to worry about that.
Hearing great things about this place, that's when I decided to give them a call and schedule my free consultation.
I actually stopped in looking at their selection of sunglasses, and I really felt comfortable and got to know some of the staff that day. So I decided to book a well vision appointment.
Who's a good candidate for LASIK? Let's try to really define that. First, if any patient who's dependent on glasses or contact lenses to see at an optimum level. Number two, anyone over the age of 18 for laser vision correction, 21 for other procedures.
At my consultation, they wanted to make sure I was an appropriate candidate for this procedure.
If a patient is a good candidate for LASIK, they'll have a sit-down consultation where they'll go into more in-depth education related to the procedure, what types of things to expect.
I learned that I was a candidate for LASIK, and Dr. Ferguson explained the benefits of having it done and also the safety in the procedures that would be done on me.
We also look at what are their goals of trying to have a procedure to minimize their dependency on glasses. Some patients want to get away from bifocals, some people want to just try to minimize their need for cheaters, other folks don't want to wear contacts or glasses. So it's important that we define that. We show patients what we can do, and does that meet with what their expectations are. It's a critical piece of being a good candidate. Then we look at the physical characteristics. That's kind of a no-brainer. We want to make sure that the cornea topography and corneal health is good, their tear film is normal. We do a lippy scan on every single patient. Tear film is so critical. And why a lippy scan? Because it lets us observe the meibomian glands of the eyelid. Meibomian glands are critical to providing oil for the tear film. The oil acts as sort of the saran wrap to protect the surface of the eye. And we also do something called a tear osmolarity. We measure the actual sample of tears to look at how much inflammation may be present, and those alert us to patients that need treatment prior to LASIK.
I felt extremely comfortable after speaking with Dr. Ferguson about having this procedure.
Whether they're a first-time patient or a long-time patient, they're going to have to fill out a medical history, or we'll review their medical history with them. They'll take some time and do some testing with Karen. At that time, Karen will then go and have some discussion with them related to the procedure itself after she's identified whether they're a candidate or not.
Karen Tobin was one of our first employees when we launched Dunes LASIK Center, and she has great experience. She's excellent patient care, very organized, and has been a real asset for us in Dunes LASIK. Dr. Womack, great ophthalmologist, general ophthalmologist, cataract surgeon, eye surgeon. He's Mayo Clinic trained. Dr. Womack has grown up in LASIK. He was one of the first surgeons in the United States to perform LASIK. At one time, he had performed almost all of the LASIK surgeries in North Dakota. What we have seen over the years is the evolution of technology, dramatic elimination and almost reduction in complications. So there's very little in the world of LASIK that Dr. Womack and I have not seen.
They have an incredible reputation in this field, and that makes me feel confident in their abilities.
What's unique about our center is that both Dr. Womack and I function somewhat independently. I create the surgery plan, I evaluate what the patient's needs are, I control the tear film analysis and treatment, and Dr. Womack takes a look at the physical characteristics and also reviews the surgery plan and has a critical eye on it. And patients love that approach. You can't buy experience, it just comes with time. It also gives us a better predictor of the future, of applying technologies and treatments to minimize the risk that any patient could go through and get the outcome they're looking for. And that's why we're successful. You cannot be an elective procedure without having a successful team and having successful outcomes, and we've been very fortunate and blessed to have that.
There's something about Dr. Ferguson that makes you just relax, trust everything, and you don't have to worry about it. He's gonna be so straight with you. They're always well within your price range.
Cost and affordability was important when making this decision.
Patients that are seeking LASIK many times have a lot going on in their lives, like we all do, and trying to focus on that amount of money at one shot sometimes can be a burden.
A lot of people don't consider the costs that are associated with wearing contacts. You have cases, you have solution, you have to buy the product.
I would guess that I spend a couple $100s a year on my glasses and contacts.
LASIK helps reduce or eliminate those costs.
Conveniently, the Dunes LASIK Center has an online calculator that compares what you spend in contacts and glasses versus what you would spend on a LASIK procedure and tells you what you would save over your lifetime. And I didn't realize that having this procedure done could actually save me tens of thousands of dollars in my lifetime.
LASIK pays for itself.
If LASIK isn't in our patient's budget, Dunes LASIK offers options to make the procedure affordable. We offer interest-free financing, and many patients will use their Flex dollars or HSA accounts.
I think the difference between our center and perhaps other centers that offer a discounted approach is that we're focused on one thing only: the absolute best care, the best technology to provide the best outcomes. We don't cut any corners. We have the same fee for either procedure that we might offer. Things we do daily here that are routine to our center may not be a routine to another center. We want to treat everyone like a family member. We wouldn't cut corners on our family member. No one would.
He loves what he does, he loves his people, loves his clients, and he wouldn't tell you to do something that he didn't honestly believe you needed or that would be good for you.
I've always wanted to provide care and a center that I would want to go to myself. Technology allows me to provide better patient care. The state-of-the-art care is customized treatments with the intralace, which is a laser that makes the flap. The word intralace means we're combining two lasers. The first laser gently makes a very precise little incision so that we can move the flap over. The second laser then applies the correction, the treatment, if you will, for your vision correction. The flap is then placed back and recovery begins. If we think of iDesign, think of it as a more personalized vision correction. Standard vision correction, let's say a -4, it means you're nearsighted, you get -4 units of correction. But in the world of iDesign, that could be -3.97 with a subtle amount of aberration treatment added to that. So it's an amplified vision correction. It's really changed the game from what we've been able to do in the past. And that's why patients have better nighttime image quality and have incredibly good uncorrected vision in normal lighting hours. So we're using the most current research, the most current technology to enhance patient diagnostic and treatment outcomes. This is not unique technology. It's a technology that's available to any eye doctor in the country. We choose to bring it to our patients because we want to provide the absolute best possible care that we can. We challenge ourselves to be as good as we can. We're not afraid of investing in our practice and investing in our patient care. Every single patient we see, we want to have the best possible outcome and experience for them.
I am nervous about the procedure, but I'm also really excited for it.
Some patients are nervous, but Karen will do her best to educate them so they can make sure they're well informed. We'll do everything that day to answer any questions they might have along the way, and they will receive some medications that will help them stay relaxed so they can focus on the procedure itself.
I do have a lot of trust and confidence in Dr. Ferguson and Dr. Womack and the entire staff here, and knowing that I'm in the hands of true professionals like that is really calming to my nerves. After the LASIK procedure, I was able to come home, relax, and get a good night's sleep. When I woke up the next morning, it was unbelievable. No glasses, no contacts, but I had clear vision.
Had the surgery done, went home, slept for like 6 hours. I sat up out of bed, looked at the clock and said, it's 7:46. And I was 13 feet away and never done that before in probably 20 years.
The procedure itself takes less than 10 minutes for both eyes.
You don't feel it, it's done. In, out, quick, easy. painless.
I didn't experience any pain, which surprised me. A little bit of discomfort maybe for the first couple of days, almost kind of like I stared in the sun a little bit too long, but no pain, and I was back to normal.
Your initial recovery is about 4 to 5 hours, which is remarkable to consider that you had a surgical procedure and in 4 to 5 hours your eyes are feeling pretty darn good. We ask patients to rest right after LASIK, and in that short period of time they're feeling pretty good and vision is already responding. So it is a remarkable procedure from that standpoint. But there's, the minor discomfort is in that 4 or 5 hours afterwards. I use the analogy, it's like really strong shampoos in your eyes. You get a little bit of light sensitivity and blinking and watering, but that's a normal response.
Your first follow-up appointment is the day after your surgery. Follow-up appointments after your surgery will be at 1 month, 3 months, 6 months, and then we'll see you at 1 year.
I didn't feel any pain during the procedure. The next day, there was just a little bit of discomfort. However, Karen had set me up with a regimen of eye drops to follow to stay ahead of the dryness that can be caused.
The number one side effect that patients experience from LASIK is dry eye symptoms. Most of those resolve over time. We take the tear film and dry eye issues very seriously in our clinic, as we do in LASIK, and we proactively treat patients prior to surgery to try to minimize their effect of dryness on their eyes, as well as improve their outcome. So we make the journey smoother, easier, and more predictable by treating the tear film aggressively prior to surgery.
Post-LASIK surgery, my vision today is 20/15, which is better than my vision has ever been in my life.
The standard for great vision is 20/20, meaning you can see a letter at 20 feet that you're supposed to be able to see. If you had 20/15 vision, you could see it further back, for example, which is better than 20/20. Someone that's legally blind is 2200, so the size of the letter is 10 times larger than average.
Prior to LASIK, my vision was terrible. I could not read this far in front of my face. When I got done, I had 20/15 vision. I was reading things that normal human beings should not be able to read that far away. It's a life changer.
We were able to take patients beyond perfect vision through correcting more precisely. So when the laser corrects the vision, it is at a more precise correction than we can offer with glasses or contact lenses. And we also influence the quality of the image by treating aberrations. There's abnormalities to the optics treated with the laser today, which we did not have that capability of decades ago. So that's where the outcomes are where they're at.
I could see clearly. And as each day went by, I felt like my vision got a little more clear.
Get this done. You wake up every day like you've had 20/20 vision your entire life. When you get it, the first question you're gonna ask yourself is, why did I not do this sooner?
In the world of LASIK, doctors are judged by how patients see. All eye doctors are judged by how a patient sees, regardless if it's glasses, contact lenses, or from a laser vision correction. Therefore, we want to use technology that's gonna give us the best possible outcomes, proven outcomes for patients. If we can exceed expectations in vision, that's always a home run, and that happens on a monthly basis here. And so by using iDesign, intralace procedures, and controlling the tear film, we get patients to be thrilled with their outcomes.
I can honestly say I had outstanding care from everyone at the Dunes LASIK Center, and I would recommend Dr. Ferguson and Dr. Womack for the same procedure. I am extremely satisfied with my results, and I attribute that to Dr. Ferguson and Dr. Womack.
I absolutely would recommend Dunes LASIK to anyone that is looking at having LASIK done. I actually carry their referral card in my wallet.
I already recommend Dunes LASIK to my friends, family, people I don't even know. I'm like, are you going to see Ferg? You need to see Ferg, he's the best.
People travel many, many miles to see us, and I'm honored by that. I think our doctors and staff are honored by that, and I'm gonna get a chance to be an eye doctor once in my life. And I'm going to do it as well as they possibly can, and I'm going to use all the resources and tools that are available to me to provide, number one, a place that I would go for my eye care, and number two, that's going to be something that I think patients really need and will really desire.
It's like a completely different way to see things. I mean, because you're seeing things that you didn't notice before because everything's clearer, it's sharper. You can see.
So I feel like I am finally fully participating in life.
It literally is the easiest thing that you can do to make a life-changing situation that has hampered you for so many years go away.
The proceeding was a paid promotional announcement for Dunes LASIK Center in Dakota Dunes. See the world clearly and free your face.
It has been ultimate freedom.
I could see clearly.
It was amazing.
Visit duneslasik.com or call to learn more.